It's been a long week, so I am just kicking back tonight with my best girl. We have a really interesting patient with an interesting nail that split down the middle today. And it's been a problem for her for a really long time. So she's a lovely lady. She's been coming for a very long time, and this nail is just not going to get better. But we can keep it from snagging on her socks every day. So I hope that you enjoy the video.
So what you're seeing is just some black under the nail here, and my guess is that it's probably soft fuzz. But this is an unusual nail. It's actually a split nail. You have this piece right here and a second piece over here, and they kind of meet in the middle and make it almost like an upside down V. So that's why it's difficult to cut and probably why stuff snags on it over here. So I'll smooth it down as much as I can, but don't worry about the black that you're seeing because they're gone. Right, okay? Yeah, I'm going to put them with some sitting here. Okay? Is that just rubbing on the top of the shoe? This toe right here? Yeah, I think so. Yeah, that's all it's going. I guess the moral of the story is we should leave you in the room alone so long. Now, last time you were here, you were dealing with some trigeminal neuralgia in your face. And what's going on with that? Well, they're still trying to take care of it, but then the two teeth that it was hitting had to have root canals done on both of them, so they thought, well, maybe that's it. Well, then, it would explain what is explaining all the hurt starting in April. But anyway, I got the teeth taken care of, and then at Thanksgiving last week, I was eating dinner, and all of a sudden it just hit me. You don't ever know what's going to do it. And they just give me a lot of pills. I mean, I'm on gabapentin, the highest amount that you can take 2 times a day. And now I'm also taking oxycodone. Oxycodone or oxycontin. Oxycontin. So that's the twice a day. Yeah. So I'm just going to remain taking that until January 6th, and I see my neurologist. Okay? I talked to patient care person about the oxy stuff just yesterday, and she said I'll just move everything over to her because we're more doing surgery instead of taking care of it with pills and stuff. So.
We'll see what she says, my neurologist.
Yeah. Yeah, that's a tough one.
It really is. When it's so intermittent. Prettiest toe I have in all
Out of your 10?
the 10 toes. The big toe seems to be the prettiest. What do you think?
Yeah, I don't tend to think of toenails as pretty or not pretty. I think of them as ingrown. So this is where we have that split nail. So this is one piece of nail right here, and it's separate from the other side. And this is the other side. So probably somewhere there was an injury that injured the nail bed down here in the middle, and it formed some scar tissue so the nail doesn't grow in there anymore. So you've got 2 sides of the nail growing, and the piece in the middle is not. So We just have to make sure that we keep it smoothed out so nothing snags. These are not my favorite nail clippers. But they'll get the job done. Well, you're also lucky that with your trigeminal neuralgia, that it isn't constant and it is only intermittent.
Mm-hmm.
Because for some people it is very constant and life-changing.
Oh, yes. Because if I had the pain all the time, I don't know what I would do either.
Right. I mean, chronic pain causes depression,
Mm-hmm.
and people do,
Awful things.
to themselves when
Mhm.
when they have chronic pain. It's always a concern, but yours seems to be managed with you're on the gabapentin
Mm-hmm.
and then the OxyContin,
Mm-hmm.
which, if you need it, then it's a good thing it's there for you.
Right.
And just to explain, OxyContin, which also carries the street name of hillbilly heroin.
I don't think it's that, because it's oxy, and the last 4 letters are pine. I'm sorry, I just.
No. So it's not a narcotic then. Okay, my mistake.
No, it's not your mistake. I should know the name of it.
Oh, oxcarbazepine? That's trileptal. It's an anti-seizure drug, but I guess they use it for this nerve pain as well.
Yeah, that's
Okay, or as another doctor I know calls it oxcarbazepine. I think it looks like oxcarbazepine, but okay.
Yeah.
So it's not narcotics. Just to be clear.
I'm glad you got that. I said something. Oh, see, that's rough, right?
Yes, that's either just a little soft fuzz or a little bit of, like if you got a little bruise under the nail maybe. And that'll just grow out as the nail grows out.
So it is still growing.
Oh yeah, this nail still grows. It just grows in 2 separate pieces. If you wet it down, you can see that a little bit better. So when you wet it down, you can see the skin right up the middle here a little bit easier. And then this just looks like, again, either it's just a little sock fuzz or you banged it and it's a little bit of bleeding under the nail. But yep, you got 1/2 of the nail here, 1/2 of the nail there, and in the middle, this is skin or scar tissue. So if we just keep it smoothed out, it won't be a problem.
I think you and my toes, thank you.
You what?
I think you and my toes, thank you.
Oh, you're welcome.
Just feels like my feet are, the bottoms right at the top, are getting more, what's the word, numb.
Well, and that's the conversation to have with the neurologist as well. It may all be connected.
Oh, I'm sure it is.
Now, once you got the root canals done on your feet, or on your feet, on your teeth, did that help the pain at all?
No, I don't think it changed it at all. I mean, yes, it's very intermittent now, it's not constant,
Okay.
but yes, and yes, I needed the root canal, you could see it on the x-ray. And so that's why it just all evolved
Yeah.
into that, but I was shocked when I had it again just last week.
Oh, the nerve pain.
Mhm.
Yeah. Well,
And-
oh, go ahead.
When I have it,
Mm-hmm.
and like you say, some people have it all the time, oh, so sad.
Yeah.
I can't imagine.
Chronic pain is tough. Well, thank you for letting us do the video.
Oh, sure.
And then you use this underneath here,
Oh, I put it on the, no,
the
yeah,
middle one?
Yeah.
Okay. And I'm just gonna put a little Band-Aid on that before you go.
okay,
You just leave on till tomorrow. It's not really bleeding, but,
okay,
okay. We will see you back in a couple months.
thank you.
You're welcome.